Use of artificial intelligence towards computerized tomographic scanning in assessment of lung cancer. One of the deadliest cancers in the world is the lung cancer, which accounts for about 1.6 million deaths worldwide. Generally, lung cancer is detected in its advanced stages with nodal spread and metastatic disease due to the absence or mild symptoms in the initial stages of the disease. But now, due to the use of the artificial intelligence technique, we can recognize even the smallest malignant growth in lungs and prevent early mortality in patients suffering with lung cancer. Conventional techniques for identifying the lung cancer. In the olden days, chest X-ray is mainly useful to detect the lung cancer. Later on, some of the techniques such as sputum cytology, lung biopsy, pulmonary functional tests are also useful for the detection of lung cancer, but they didn't show promising outcomes. The introduction of the new technique called as computerized tomography is useful for the imaging methodology in early findings of the lung malignant growth. Now, the advanced stage is the use of artificial intelligence in computerized tomographic technique for the findings of the smallest malignant growth in the lungs, which prevents early mortality in patients suffering with lung cancer. The process used in this technique involves collection of samples, which includes the CT scan of lungs in patients with lung cancer and normal healthy individuals. Then we train the framework utilizing the pictures we have gathered from both the individuals enduring with lung cancer and normal healthy individuals. During this preparation time frame, we train the PC, which examines the dangerous lesions and which do not contain them. Then we provide the PC with the test images, which undergoes overlapping image patches and finally gives the output, including the smallest malignant growth in the lungs. Here, in this image, we can see the comparison between the CT scan without AI detection and with AI detection. Normally, in the CT scan, we cannot detect the minute nodules of the cancer, whereas this artificial intelligence can distinguish the small bits of malignant growth on CT filter more precisely and with high accuracy than the normal CT scan. These are few of the applications of artificial intelligence in healthcare. Mainly in diagnostic purposes, it can minimize the diagnostic error and also medical imaging insights, and it is mainly useful for the early diagnosis of the disease.